Hello, Junior Doctors! Welcome back to Junior Doctor Fiona Chow's YouTube channel. In today's video, as mentioned from last video, we are going to talk about the symptoms and diagnosis of Alzheimer's disease. Okay, so let's start with the symptoms. The symptoms of Alzheimer's disease is, first of all, the confusion of time and location, as well as the patient withdrawing from social activities. In addition to that, there's also difficulty with solving problems, with demonstrating appropriate emotions. For instance, if the patient is hearing some sad news, possibly they would smile. But it's not intentional, it's just because there's not a right connection between neurons that allows the brain to perceive the information and demonstrate the right emotion at the right time. In addition to that, there's also difficulty with words and trouble with images in space. This is caused by the cerebrum, because the cerebrum helps us to judge our balance, our motor movements. And next, it's misplacing items. This is basically dementia, when the patient forgets what they have said before or what they have put somewhere. This is dementia. And it's also having the difficulty of completing a very simple and familiar task. This is a big symptom of Alzheimer's. So as you can see, although Parkinson's and Alzheimer's is kind of similar, but there's still some distinctive features and symptoms that each has in their respective disease. Next, we're going to talk about the diagnosis. So that the diagnosis, there's not a particular machine or tool that helps us diagnose Alzheimer's. However, doctors would first check the patient's medical records to actually think whether if it is Alzheimer's. In addition to that, they would also schedule exams of cognitive skills and effects, symptoms, and personality shifts, because personality shifts is quite a big part of Alzheimer's. Because Alzheimer's, a lot of patients would experience very weird personality shifts and emotion problems, like for instance not being able to demonstrate their emotions properly. So that is also something the doctor would assess before diagnosing the patient of Alzheimer's disease. In addition to that, let's talk about prevention, which is really important. So healthy exercise and diet really allows more nutrients into the body, so this would really decrease the likeliness of getting Alzheimer's disease. And however, in addition to that, there is the treatment I'm going to talk about next time that would also suppress the symptoms and prevent these diseases of Alzheimer's. So that would be it for this week's YouTube video. But next video, I'm going to talk about the treatment as mentioned. So stay tuned for that, and remember to like it up, subscribe, and turn on post notifications. Thank you so much, and see you next time.